evening, ladies and gentlemen, and welcome to another edition of What's Happening. I'm George Binns, and I'm here with my co-host, Elliot Margolis. And we have as our guest this evening a return engagement by Brett Ferrell from Bay State Physical Therapy. The previous visit, we just talked about physical therapy, and if you recall some of our previous shows, we had a discussion with Judith Cronin about the addition to the Beverly Y. And as part of that addition, Brett gets more space. So how much more space are you going to get out of this?
So we're adding on a few hundred square feet onto our current space.
You got how much right now?
So right now we're at about 750 square feet. We're bumping up to about 1,000 square feet.
So you got like a one-third.
Yeah.
Yeah, that's a pretty significant improvement.
Yeah, it'll be nice. We'll be able to update some of our facility in there. We've been in there for 10 years now, so it'll be a good time for a facelift to our facility and be able to add on some stuff to benefit both the staff and the patients moving forward.
Well, with this additional space, I guess the question comes down to how much are you going to contribute to what you've been doing all along, just do more of it, and what are you going to be able to do new and different now that you got more space?
Right. So basically it will be a continuation of what we currently do, which is the outpatient orthopedic physical therapy. But we're going to, with the new space, be able to add on a private treatment room, which up until now we haven't had the space to have in there, which would be nice for private evaluations, private treatments, patients that require that private space for what we do with them. Also being able to add on an enclosed staff space, which will be nice for us now. And then also being able to enlarge our waiting room in our office area.
Will that mean you'll be able to handle more people?
Honestly, volume isn't our goal with this addition. It really is to update our facility and to add some of that private treatment space that we've been searching for a long time.
What is your volume there? I mean, how many people do you see in the course of a day?
Right. So right now we have 4 full-time therapists along with myself. I'm in there 2 days a week. And a typical therapist will see about 12 to 13 patients per day. So with the entire staff on during the day, we'll see about 50 to 55 patients a day in there.
That's pretty significant. That's Now, do you handle all kinds of physical therapy, or do you specialize in certain types of?
So as I said, we cover outpatient orthopedic physical therapy, which does have a number of specialties involved with that. So one of our biggest specialties would be aquatic therapy. So we also lease and rent space from the YMCA down in their pool. So 2 days a week, Tuesdays and Thursdays, we do aquatic therapy. So if someone may be post-surgical knee or hip, we can get them into the water. Back pain is another big diagnosis that we get into the water as well. The water is nice because that takes, the buoyancy of the water takes some of the load off of the joints. Patients can be more comfortable moving around, a little more mobile in there until they develop strength and develop mobility. Then we transition them out onto the land to continue their exercises. Some of them wish they could live in the pool because they love it in there so much, but obviously our goal is to transition them into their daily activities, daily lives, sports, all of those things. So that's one of the specialties we take care of. Post-surgical, once again, would be another one. And depending on the therapist, each therapist kind of has their niche, which is something that I like my therapist to develop. We have a vestibular specialist, so like dizziness and that kind of stuff. We have a therapist that likes pediatrics, so works more with the children. So yeah, we cover pretty much all realms in there as far as orthopedic physical therapy is concerned.
I was looking in my research for this, and you have physical therapy for people that have headaches.
Sure. Yep.
What kind of physical therapy is that? I mean, what do you do? I mean, move your head from one place to another? I mean,
yeah. Well, yes, actually, that is part of what we do. Headaches can be caused by a number of different things. For example, it could be what we refer to as a cervicogenic headache. So your cervical spine and issues, stiffness, lack of range of motion you might have there could be creating some of that headache, a tension type headache in there. As I mentioned before, vestibular or that equilibrium and dizziness, that can lead to certain types of headaches. So it's important, when you have a headache, if you don't know what's causing that, speaking with your primary care or coming in and having your screening directly with us, and we can give you an idea of what we think that might be. And then if we think it's appropriate for physical therapy, then you can get your referral in to see us. Or maybe we find that this might not be along our line of work, so then we'll make sure that you head off to see your primary care and figure out where to go to solve that kind of thing.
Okay, now I have an appointment with my chiropractor after this show.
Yep.
what's the difference between what he's going to do and what you would do?
So I'll start by saying that we work directly with a lot of chiropractors, and some physical therapists and chiropractors will work well together. I can say the president of our company is both a physical therapist and a chiropractor, so we're very well versed in what chiropractors do. And I think for the right diagnosis, for the right patient, I think that combination of treatments can be very beneficial to them. So to answer your question as to what would the difference be, sometimes there isn't too much difference at all, in that as physical therapists, we do some of the same joint movement that the chiropractor will do. They call them adjustments. In physical therapy, we call them joint manipulations, but it's the same thing. Crack your back, doing that type of movement in order to gain mobility through the spine. In physical therapy, we then also take it that next step and work on strengthening, so that you can take that increased mobility you have in the joint or in the spine and then add the muscle strength on top of it to control that movement, because our feeling is that it's one thing to have it moving, but if you can't control that movement throughout the day, then that's when you're going to continue to have issues, continue to stiffen up and tighten up, and then go right back to that state that you were in.
And what about massage therapy? Where does that fit into this?
So massage is part of what we do as treatment as well. With physical therapy, we're trained in all these different modalities. So as part of our treatment, so a typical treatment would typically start off with some sort of hands-on soft tissue work, massage type work. Then we'll work into the joint, depending on what body part we're working on, making sure we have proper joint mobility, and then lead that into strengthening after that to control that newfound mobility that we have in the joint. So yes, massage is part of what we do. But if someone's calling up looking for a 60-minute massage, that's not what we do for treatment. We we will work on you for 30 to 60 minutes, but only part of that would be a massage.
Go ahead, George.
It gets interesting when they do the massage. They got this little stick about so long with a bunch of balls on the axis, and they run it up and down your leg and up and down your back. And
I had a massage therapist once, and she was taking her elbow on my back, and I'm telling you, I thought the elbow was coming through the other side. I mean, she was
talk
really...
about sharp elbows, right? Yeah.
She was... she brings tears to your eyes.
Yeah. And with massage, just like everything else that we do, there's different types of massage and different reasons for doing that. So a deep pressured type massage, you will be good for certain things, and for others it needs to be a little more gentle, a little more relaxing. But yeah, absolutely, all types of massage.
Well, it's a slightly different subject. There's 3 of us at the Y right now that have had hips replaced within the last year or so. And different doctors have different approaches to it. As you know, my doctor said, go see a physical therapist, and I spent, 3-4 months with you doing all the rolling with the funny thing and other stuff. One of the other guys, he's got a different approach that, because he's younger than me, he needs to get much more mobility back and much more strength back, because he wants to continue to be quite physically active. And the third guy doesn't seem to be doing any physical therapy at all. And the book I was reading had an interesting comment that if you had a knee replaced, then you definitely need physical therapy. You get a hip replaced, maybe not. It'll take care of itself. Mm-hmm. Where do you come down on this?
Well, I will say that as far as recovery and need for hands-on work by your physical therapist, knees do tend to be more difficult. That's kind of the nature of the joint, scar tissue that forms in there. But with that being said, it really does, kind of what you were implying with the 3 different examples there, activity level that these patients are looking to get back to. Someone who's not expecting a whole lot out of their body moving forward, they might not have to do as much. They might not have to gain as much flexibility or strength. But with that being said, I still recommend that they get in and have some sort of physical therapy. Might not need to be as much as the next person, but to regain that range and make sure that they're able to function to their fullest capabilities moving forward. I hate for my patients, whether it be after surgery or anything, to just settle for being okay. I want our patients to try and get back as close to 100% as possible, and that 100% is going to be different for everyone, like I said, based on their activity level and what they strive to get back to. But I do think that it would be important for everyone that has a total hip to come in and have physical therapy.
Well, the other piece of the game, I guess, is like I went through Medicare, so I got just so much physical therapy that they allow and said, hey, that's all you're going to get, because that's the rules of their game. We talked a little bit before about the transition from Bay State to the Y. And the Y has a bunch of programs. They have a bunch of physical trainers and all that. That I never got into. How does that really supposed to work?
As
What
far as
am I
the
missing?
transition from Bay State physical therapy
Yeah.
to the Y. So we have.
When do you need a physical, get out of the range of what a physical therapist is doing
Into a personal trainer.
personal trainer? And what are you looking for in a personal trainer coming off, in my case, like surgery?
So a personal trainer is trained to work with a healthy individual. They're not trained to diagnose an injury. They're not trained to rehabilitate an injury. So once we get the patient to a point to where they're healthy enough, strong enough, and able to go out there and work in the gym, then that's when, especially if their insurance has run out, and every insurance is different, and that's why we just ask patients, if they ever have a question, come in and ask us, and we can look into your insurance benefit and figure out how much physical therapy you're allowed to have with your insurance. But then once we're done, then we look for that personal trainer to continue on with that strengthening or just gym program out there. So we want our patients, especially if they're Y members, or even if they're not Y members, becoming a Y member, being able to utilize that Y. Because for us, we feel strongly about patients continuing to do their exercises after they finish with us. It's one thing to spend 2-3 months with us, but then if you all of a sudden stop doing everything strengthening wise, I think we all know you're going to lose a lot of what you built
Yeah,
up.
atrophy sets in
Absolutely.
very quick.
Yeah, so we have a nice program set up with the Y. The Y has recently allowed us to have any one of our patients that is not currently a Y member have 2 free weeks membership to the Y, and they can utilize that while they're in treating with us, or they can wait until they're done treating us with us, where they can fully use the Y. If initially maybe they can't use a lot of it because they're too injured to do it, they can wait till the end. And then after they've used those 2 free weeks, then the Y has a discounted membership for 2 months that the patient can sign up for the Y at a discounted rate as well.
Well, the next question comes down to is that when you go to see a doctor, they give you a prescription for, most of the time it doesn't say just evaluate and treat. And it's left up to you to figure out what that really comes down to. When you transition into one of these personal trainers, do you set up a prescription, said, well, this person just had a hip replaced or a knee replaced or a back injury, and they need this particular kind of exercise or this particular machine? Do you go to that extent?
Yes, we do. And that's one great thing for us about being in the Y and as well for the Y trainers, that we have direct contact with them. We have a lot of cross referrals. They bring clients of theirs in who might be having an ache or pain, and we'll do screenings, kind of figure out what's going on with them, and then we refer back to them. So to answer your question, yes, we do have referral forms that we give to the personal trainers, and obviously with the consent of the patient, telling that personal trainer what was their injury, what kind of strengthening, what kind of stuff do they need to continue to do out in the gym. So there is that direct back and forth that we give them, and the personal trainers out there know at any time if they have any questions, they can come and pull one of us aside to ask about the patient if they have any questions with that. So that's been very convenient for us and for members with that.
Yeah,
What kind of education do you have to do this type of work?
For a physical therapist, so we have right now, it's 7 years of schooling to get your doctorate in physical therapy, and all accredited programs right now, so all programs that physical therapists are graduating out of are doctorate programs. So it's 4 years of your undergraduate college training, and then from there you're going into the doctorate program, which is another 3 years after that.
Interesting. So you
Well,
work
they know
pretty
it-
hard.
Oh, yeah.
Well, they know what they're doing, yes.
Yeah. So, and then I think too, sometimes the difference between a physical therapist and a personal trainer, sometimes people don't necessarily understand the difference between the two. And for a personal trainer, they have a certification, but they don't necessarily have to have gone to college to have that certification. So that's where, like I differentiated before, the personal trainer is going to work with your healthy individual. And anyone that has that injury, they would be coming to us because we're licensed to diagnose. You don't even have to go to your doctor prior to coming into seeing us. You don't have to have a script from your doctor. The only reason that we require a script is if you're going to use your health insurance. But if you wanted to self-pay, you can come in and we'll diagnose and treat and do everything that we can do, under our license.
Okay, now we're going to talk about a personal issue.
All right,
Okay.
let's hear it.
because before the show you promised that you'd improve my golf game.
Was it a promise?
I thought so. Anyhow, is this the type of problem you would work with? I don't have a full backswing. I've got like bursitis in my shoulders and whatever, and I can't get a full backswing. Is that something that you have exercises for to?
Absolutely, absolutely. So there's different things, and on the surface it might sound easy. Okay, I just can't rotate far enough, and so just teach me how to rotate more, and I'm good to go. But then you mentioned too, could this be coming from my shoulders? Could this be coming from your spine? Is it something having to do with your hips or your knees, or maybe the balance simply that you have? It might not be an issue up here, but your balance might be throwing you off. So there's a number of different things that we would want to look at and assess with that. So sometimes what we'll do is we'll even bring in, whether it be for a golf game, talk to your golf pro, whoever's training you, trying to perfect your swing. For swimmers, we'll bring in the swim coach. For us, it's good to bring in the professional that's trying to teach you this technique so that we can know, okay, this is what our patient is trying to achieve, and then we can break down that system, biomechanically break you down to know what exactly you're not able to do that will allow you to get to where you need to be.
Okay, and then one of my other, I have a lot of problems with golf. Let's get the record straight.
Yeah.
But I put a little hoo-ha on the top of my putter so I don't have to bend down to get the ball out of the hole if it goes in there. And bending down is a problem.
Yep. Yeah. And that type of device on your putter, is a great thing. But then it's not only bending down to pick that ball up, but standing there, bending over to, do the putt, to hit your drive, all of those things. So, for us, one of the first things we would look at would be some of your spinal mobility in there. And so you're seeing the chiropractor right now already, so that's a good start for that. And then, like I said before, now, okay, so maybe we're getting these joints moving, but are the muscles able to accommodate that joint movement and able to, utilize all of that in your backswing? So that's what we would really look at and work on training those muscles, training that whole system to work for you. And like I said, there's multiple components that we would look at, not just the spine, not just the hip, not just the shoulder, but how do they all work together in order to get that one motion that you're looking for.
And this is going to reduce my handicap by how much?
On average, 10 to 15 strokes. You sold yet?
That sounds good.
We'll see you there tomorrow morning. 8 o'clock, right?
Absolutely.
But I guess the issue comes down to a lot of times that somebody has gotten injured, hurt, so forth. And one of the neat things I particularly appreciate about your operation there, and I guess it's standard with Bay State, you got a little sign up there that says you can come in for a free consultation. And I've talked to a bunch of people that have been doing something and, that doesn't hurt right. Something's wrong here. And you send them into your shop and maybe you can help them, maybe you can't. Or maybe you just tell them that, hey, you got a serious problem. You need to take a couple of weeks off or something.
Yeah.
How far can you go with one of these free consultations?
Well, so from our standpoint, we want to give this, typically a gym member, but it doesn't have to be a gym member. Even members of the community can come in and have free screenings with us. We want to give them peace of mind that whatever that next step is, they know what they're doing next for that injury. So whether it be, like you said, just a little bit of ice on it and they should be okay in a couple days, should they get back to see their primary care? Because this might not be an orthopedic injury, an orthopedic issue, or should they just call up and get a script for physical therapy? That really is our goal with that. Typically, we spend about 10 to 15 minutes with someone, and we'll do some hands-on assessment with them during that screening. So it's not a formal treatment session. It's more so kind of a fact-finding session that we do with them. But like I said, typically about 10 to 15 minutes. And we'll have people that we'll see for a screening and tell them, okay, listen, go out in the gym, just try these couple little things out there. Come back and follow up with us in a month. Do these couple strengthening things. Let's see if that gets you over that hump quick and easy. Follow us with us in a month. If that doesn't do the trick, then we can talk about some formal physical therapy or whatever the next step would be. So ideally, for the gym member, it's not going to take much, and they don't even necessarily need our services. But for us, we want the gym member to know and the community to know that they can come in and have screenings with us, pretty much at any time. They just need to give us a call or stop in if they're already in the gym and set up a time with one of the therapists.
Is this Bay State wide? Or just,
Yeah.
Yeah.
All of our clinics, if you call up and say that you have an injury and you'd like to speak with a therapist, for a screening prior to setting up formal physical therapy, you can call any of our clinics and they'll get you set up.
how many clinics do you have?
So now Bay State has 42 clinics. We have grown throughout eastern Massachusetts and up into southern New Hampshire now. We're actually the largest provider of outpatient physical therapy in Massachusetts. And I direct and operate our Beverly and our Salem location, as well as I have a co-partner in our Reading location too. So I'm in all three
Is
of
that
those
Heather?
locations. Yes,
Heather,
Heather, who
yeah.
you know, Heather Waters.
Oh, yeah.
Yep.
And she got her doctorate, what, 2 years ago now?
Yeah, from UMass Lowell. Yep.
Yeah. And I noticed you have a bunch of interns in for the summer.
Yeah, so during the summer, it's a common time for the different doctorate programs to send their students out for their clinical affiliations, their internships. So they'll spend anywhere from 2, 3, sometimes even 4 months with us. And then during the other parts of the year, universities like Salem State University will have exercise physiologist type students that need to have some kind of clinical experience or get in there, and they'll do some observation with us as well. So it's been nice for us. It's a good experience.
Well, that gets down to the question of when you have an intern in there, how much are they getting involved in the treatment as opposed to just standing around and watching or listening? And
Right. And that has to do with where they're at as far as the stage of their program is concerned. If they're a doctoral student at one of the local universities or colleges, then depending on if they're in their first clinical rotation, second, third, or some even fourth, they're expected by the school, and we have a curriculum that we kind of have to follow with them, or expectations that we have for that student, for that clinical intern that's in there for how much they're supposed to be doing. If this is their first time out in the field for their first 3 months, they're going to be a little bit of hands-on, a lot of observation, with us. But as they work their way into their second, third, and maybe even fourth clinical rotation, at that point, they're expected by the school and expected by the therapist to be able to take on almost a full course load, because they have to demonstrate that they're ready to go into the field, because the only step after that for them is taking their board, sitting down for that long exam, and then they're a licensed physical therapist. So by the time they reach that stage, they are expected to have the knowledge and have the hands-on skills to be treating. So once again, it just depends on where they're at in their schooling.
so really the only hands-on experience they get is in one of these internships.
Correct, yeah.
So the boards are just write it on time.
That's making sure that they've obtained the knowledge, but then
Yeah.
the hands-on work, and that's why it's so important and why we take it so seriously, educating our students when they come in and making sure they get a good experience with us.
Yeah. It just proves they know the Latin of all this stuff, right?
Exactly.
In looking at some of the things that you do, I see that you do men's and women's urinary incontinence.
So that's not actually something that we do in the Beverly facility in here. So that would be women's health is the name of the specialty for that. But that's not something that we do in Beverly, but some of our clinics do. And if you ever have any questions about that specialty or any specialty, you can go to our website, baystatept.com, and click on a specialty on there, and then it'll show you which location to call up.
All right. I mean, you guys, I have to say, you guys have a great reputation.
Well, thank you.
Because I hear about you a lot. I have not been to you,
Well, it sounds like you need to come in.
but I may need to. But no, I mean, the different things that you do and that you've described, it's fascinating. I mean, you're right. People just have to call and see.
Yeah. It's very easy. You'll find that we have very friendly clinics. So it's just a matter of making that first call, come in, speak with one of the therapists, and I think you'll be comfortable following up after that. I really do.
Yeah, it's a fascinating field. I mean, I know from my chiropractic point of view, I mean, I've had some problems. He's taken care of it. He recommended me to a massage therapist. But I've gone to physical therapy before. It helped a lot. I mean, but I didn't realize that you could have physical therapy for so many different things.
Absolutely.
I mean, I know about the surgery, and having therapy for that, but I didn't realize all the things you're talking about.
And that's part of our job as physical therapists, for our profession, is letting the general public know everything that we are trained in doing. So honestly, any ache or pain that you're having, muscle, joint, anything like that, stop in and talk with your physical therapist. It can definitely benefit you moving forward.
The one that surprised me is I get a dose of vertigo once in a while, and there's a maneuver, the Epi maneuver.
Epley, yep.
Say it again?
Epley.
Epley maneuver. I don't know the Latin. I used to be an altar boy. I can't handle that stuff. But you don't do it in your shop, but your Salem outfit.
In Salem, I have a
So,
specialist,
I mean,
yes.
the range of stuff that they cover is, like you say, it's unbelievable that you can get all these kinds of treatments. And most of the time, I think a lot of people don't recognize, like you're saying, is that, oh, there is a place to go for that without having to go get a prescription, go find a doctor, go find a orthopedic surgeon or something like
Well,
that.
but you do need referrals from doctors to have the insurance paid.
Yeah, that's the hooker.
To use the insurance piece. And that's
Yeah.
something as physical therapists that we're working on, down the road so that our patients can have more direct access to us without necessarily having to jump through too many hoops. Because we do understand that that is a big issue for a lot of patients. They don't want to spend 2 weeks before they can get in to see one of their doctors before coming in to see us. So that's something as a profession we're certainly working on. We understand the struggles with that, but we try and make it as easy as
Well,
possible.
can you do it sort of retroactively? Like, say, go to call your doctor. Your doctor can't see you for 2 weeks. You're in pain. Go to you, get an invoice, go to the doctor and say, hey,
Right.
Can you give me the referral for this?
Right, and that's not typically the way that it does work, that should work, but what we can do is we can do that screening, we can maybe get you started, on some ideas of what to do, and or if you've seen your doctor relatively recently in the last few months, a lot of times you can call over, speak with them, and they'll just fax right over a script, so you don't necessarily have to go into them. But hopefully you have a good relationship with your primary care already so you can make that call.
Yeah. Well, I hope that people have learned a little bit, like, don't be afraid to ask your doctor for physical therapy.
Absolutely.
And don't be afraid to call them, and don't be afraid to call you.
Yeah, just stop right in. Yep, absolutely.
That's the important thing, that you do so many different things. And like I say, your reputation is you get the job done.
No, thank you. Good.
And I appreciate you being here,
Thanks for having me.
and I appreciate learning a lot. And I hope our viewers have learned a little bit about this, and maybe you'll get a few more phone calls
Absolutely.
and a few more patients.
Very good.
But physical therapy, I know it did work for me when I needed it. And, well, again, we appreciate you coming and reserve the right to call you back.
Absolutely.
Okay, thank you, and I hope you enjoyed the show. Hope you learned something, and we'll see you next week.